Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
Hey people, this is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to personally welcome you to episode 26 of the Ask Dr. Angela podcast. Is everyone getting geared up for Halloween? I don't know if it's any different in any of your households, but it took my little girl forever to decide what she was going to be. I mean, it was like every day it was something different. And you want to get the outfit before the pickings are slim to none. So finally, she decided on some kind of good witch, fairy princess kind of deal. And we were fortunate enough to luck up on her costume at, of all places, Marshall's. It was so nice to get it at Marshall's because, number one, it was age appropriate. So many of these costumes these days are just too sexy for kids. And then the best part of it was that it was really affordable. I don't know the last time any of you went into one of those Halloween stores or whatever, but costumes are really expensive. Anyway, enough about that. Let's just jump right into today's question. And today's question is, again, coming to us from an anonymous caller. And I don't mind that it's anonymous. It's a really good question, but I really like to know who you are and where you're submitting your question from. Because, we're getting questions from all over the world. And I'm not being funny about that. We just had a question from the Philippines a few episodes ago. And so we certainly like to know, demographically speaking and geographically speaking, where folks are submitting their questions from. So today's question I thought was really relevant. And so here it is.
Hi, Dr. Angela. I'm 48 years old and I stopped getting my period a few months ago. I had the FSH test, which showed that I was in a premenopausal state. I'm wondering if it would make sense for me to go back on the birth control pill. I've heard that sometimes that has some advantages, so I'd be curious. Thank you so much.
I'm actually really happy that you, anonymous caller, submitted this question because so many people seem to think that there's like some blood test that can predict when you are going to go into menopause. And, I can't tell you how many times, actually daily, I get asked by patients, can you please, check my hormones? What am I checking your hormones for? The only folks whose hormonal levels I'm typically interested in is if I'm trying to help someone get pregnant. And those tests, regards to hormonal levels, are time specific. So just randomly drawing hormones, quite honestly, just doesn't amount to much of anything. You are in menopause when you have gone an entire year without a period. Now, we certainly can draw an FSH level, and if that FSH level is a certain value, and I want to say that it might be around 25 or so, but don't quote me on that, then that is typically predictive of you being in a menopausal state. However, not having had a period for a few months, you're likely perimenopausal. It's your history that tells me whether or not you are perimenopausal. And I think we've had episodes on the podcast discussing perimenopause, where your periods can skip months at a time. You can get multiple periods a month. You can have spotting in between. You might have hot flashes, night sweats, vaginal dryness, all of these symptoms that characterize ovarian failure or menopause. So to the woman that submitted this question, if it's only been a few months and you've not had a period, you probably are still in perimenopause. And certainly being on a birth control pill in someone that is in perimenopause does a couple of different things. Number one, the hormones that you're receiving through the pill will help temper some of the symptoms that women can experience transitioning into menopause, whether it's night sweats, hot flashes, etc. The other thing that being on a pill certainly can help is with period regulation, because I just previously mentioned that in perimenopause, your periods can be all over the place. But the really big thing that being on a birth control pill can help with during the perimenopausal phase is contraception. And that's probably, for me, the biggest pro of being on a pill during the perimenopausal transition. And when I say perimenopause, I mean the road to menopause, because again, you're not in menopause until you've gone an entire year without a period. I can't tell you how many times a year I see a perimenopausal woman who comes up pregnant because, by golly, they didn't think they could get pregnant because they were skipping periods months at a time. It certainly does happen. So to answer your question, if you are not sure about your menopausal status, there's a couple ways, again, to check on that. Number one, if it's been an entire year and you've not had a period, you're definitely in menopause. If you had an FSH level that indicates that you are in menopause, then you don't really need to be on a birth control pill. I certainly hope that that has answered your question. And again, I'd like to certainly thank you for the submission. But next time, please leave your name and where you are submitting your question from. And you don't have to leave your last name. I know some of us are very shy about these things. Just leave your first name. But thank you. It was a really, really, really good question. And next time, again, leave your information so that we can send you one of our fantastic t-shirts. For those of you who would like to have a question featured in the Ask Dr. Angela podcast, please do so by going to www.askdrangela, that's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. In closing, I'd like to leave you with this thought. If you propose to speak, always ask yourself, is it true? Is it necessary? Is it kind? Until next time, look better, feel better, be better. Can't wait to connect on episode 27.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.